I move on to the next speaker, Dr. Goutham R. Yes, his topic is comparison of 532 nanometer multi-spot versus standard single spot green laser of PRP in proliferative diabetic retinopathy, a randomized clinical trial.
Good morning everyone. I'll be presenting my thesis, which is comparison of multi-spot PRP versus single spot PRP for PDR in proliferative diabetic retinopathy, a randomized clinical trial. PRP is the gold standard of treatment in PDR. There are two methods of PRP. One is single spot PRP and the other is multi-spot PRP. This is the first study among Indian population to compare multi-spot and single spot PRP using the Zeiss Visualis Green machine, which is shown in this picture. In single spot PRP, sequential spots are applied by moving the aiming beam. These are the usual parameters for single spot PRP, and this is fundus image following single spot PRP. In multi-spot PRP, it is a semi-automated system which applies individual discharges in certain pre-adjusted patterns. These are the parameters for multi-spot PRP usually, and this is fundus image post multi-spot PRP. The primary aim was to compare multi-spot versus single spot PRP in terms of laser parameters and functional outcomes. The secondary objective was to compare the structural outcomes. It was a RCT conducted in Jipmer between 2021 and 2022. 30 patients diagnosed with bilateral treatment-naive PDR were recruited, and these were the exclusion criteria. Consecutive sampling was done. Right eye of each patient was randomly assigned to undergo single spot or multi-spot laser by snooze technique. Single blinding was done and pre-laser examination was done. Each patient underwent one sitting in both eyes on the same day. Number of sittings of laser per eye was 2 to 3 with a time interval of 7 days between the two sittings. Visual analog scale was used to compare patient's pain 5 minutes after each sitting. Follow-up examination was done at 1 and 3 months after PRP. This table summarizes the results. As you can see, in both single spot and multi-spot laser, the spot size was the same. The average power was significantly high with multi-spot PRP. The average pulse duration was significantly low with multi-spot PRP. Fluence is the average laser energy density required. It is calculated using the formula fluence is equal to power into pulse duration divided by spot size. Since the pulse duration was less with multi-spot PRP, the average fluence was also significantly less with multi-spot PRP. This fluence, increased fluence, is thought to be responsible for the collateral damage. Coming to the average visual analog scale, it was significantly low with multi-spot PRP. The average number of spots per sitting was high with multi-spot PRP, but since multi-spot PRP is a semi-automated machine, the average time taken per sitting was significantly less with multi-spot PRP. All the data were summarized as mean plus or minus standard deviation, and they were analyzed using unpaired t-test. Coming to the functional outcomes, change in BCVA in both the groups was not statistically significant, as you can see in this graph. Structural outcomes, regression of PDR was observed in all the patients treated with either modality. There was no significant difference in pre and post laser macular thickness in both the groups, as you can see in this graph. These are the various studies across the globe using different laser machines comparing multi-spot laser and single spot laser. As you can see, almost all of them showed that multi-spot laser required shorter pulse duration, had similar efficacy and was better tolerated. Coming to the strengths of our study, since it was a RCT, it removed bias in allocation of subjects to laser groups. Since two eyes of the same patient were used to compare outcomes, multiple confounding factors have been eliminated. Individual variability in pain perception between the two groups was eliminated. And since single blinding was done, it eliminated bias in pain perception. Limitations of our study, retinal sensitivity could not be compared using Humphrey Visual Field Analyzer because of logistical issues. Conclusion, average fluence, pain and time taken was significantly less with multi-spot PRP when compared to single spot PRP. Efficacy of both single spot and multi-spot laser was similar in terms of regression of PDR, change in BCVA and macular thickness. These are my references. Thank you.
When it's a very localized, how is the multi-spot will be superior to the single spot?
Actually, our inclusion criteria was only bilateral proliferative diabetic retinopathy, sir. So we included cases with only early proliferative diabetic retinopathy, which required pan-retinal photocoagulation of all the quadrants.
Okay. Any questions from the?
Were they affected equally?
Yes. All the confounding factors have been eliminated. The confounding factors. Yes, ma'am. Regression of PDR was observed in all the cases, but the number of Yes, ma'am. Regression of PDR was noted in all the cases, but the pain perception of the eyes treated with multi-spot PRP was less when compared to the pain perception in the eye treated with single spot PRP. Also, the laser parameters like average fluence was significantly less with multi-spot PRP.
Main difference is only the pain
Pain, time taken,
and time taken, okay? But the outcome is same.
outcome is same. Macular thickness we compared.
And it's also, I think, much more, I mean, uh, less time consume and
Better for the patient and the ophthalmologist.
and price is also high.
No, sir, same price. The same machine we has two different modes.
Okay.
Same machine we
In
use
two
the two
different
different
modes,
modes.
Pain is less.
Pain is
Pain
less
is less.
because of the less average fluence in multi-spot PRP.
One question, why is the pain less according to you?
Because as shown, the average fluence was less with multi-spot PRP because it uses shorter pulse duration. So the pain perceived by the patient was significantly low. The fluence is responsible for the collateral damages like pain.
And there's one little ethical question which I'll ask, is that when you're very sure that it is better, would you like to continue with the study again?
Ma'am, earlier studies showed that single spot laser was a bit more effective than multi-spot PRP. So we wanted to compare and find out is it actually true. But in our study we showed that both are of the same effect, but multi-spot PRP has less side effects. So ethical clearance was obtained from our institute ethics committee.
How did you randomize the patients?
Block randomization using snooze technique, ma'am. Sealed envelopes.
What was the duration of follow-up?
Duration for follow-up 1 and 3 months, ma'am. First examination was done at first month and third month.
Do you think it will make any difference if you follow up for
That
more
retinal
time?
sensitivity could have been analyzed at 6th month
Yeah.
to see the field changes,
Yeah.
but because of logistical issues in our hospital, we couldn't do that.
Okay.
What about publication?
Publication manuscript I have prepared, ma'am. We are sending.